Treatment of rheumatoid arthritis is focused towards decreasing inflammation as well as preventing further joint injury. It is recommended that early aggressive treatment is initiated to decrease the systemic impact of rheumatoid arthritis. This is thought to decrease the outcome of disability and joint destruction. The longer the patient has been living with the disease without treatment, the more difficult it is for the medication to have a positive effect for the patient. The use of potent and well-tolerated medications, both traditional and biological disease-modifying anti-rheumatic drugs, are used alone or in combination to induce and maintain control of the disease. Methotrexate is the first-line initial disease-modifying anti-rheumatic drug monotherapy. Prior to initiating treatment, lab values need to be drawn, which include a CBC, serum creatinine, and an ALT. Along with this, assessment of comorbidities, vaccinations, hepatitis B and C screening, as well as TB infection screening are all performed. A chest X-ray is also performed to ensure there are no underlying pulmonary issues due to the increased risk of pneumonitis. Methotrexate is given in a single weekly dose with the starting dose between 7.5 milligrams and 15 milligrams by mouth once a week. Dosing range is dependent on the size and weight of the patient, as well as how active the disease is for that patient. Increase the dose every 4 weeks by 2.5 milligrams to 5 milligrams per week until the disease symptoms have subsided. The target dose is 15 milligrams to 25 milligrams max every week. Methotrexate works by inhibiting the folic acid metabolism. It inhibits the binding of dihydrofolic acid to the enzyme dihydrofolate reductase. This is responsible for reducing dihydrofolic acid to folinic acid, which is an active intracellular metabolite. This decreases the amount of intercellular 5-formylin tetrahydrofolate that is available and affects the metabolic pathway within the cell that are 5-formylin tetrahydrofolate dependent. The metabolic pathways involved include the purine and pyrimidine metabolism. Another way methotrexate works is by the adenosine receptor-mediated effects. It increases the extracellular concentrations of adenosine, which is an autocoid that has anti-inflammatory activity. These two mechanisms of action are the most important for the patient with rheumatoid arthritis. Side effects are usually mild, with the most common one being GI upset.